Welcome, everybody. This is the mayor's meeting of the Mayor's Commission for Citizens with Disabilities for the City of Omaha. I want to welcome our audience, our guest, and the members of the commission, and our sign language interpreter. I want to remind you that this meeting will be taped, and that it will be presented at 7 p.m. Each Tuesday following the meeting on Channel 18 of Cox. Videos of the meeting can also be viewed at the Disability Commission's website, and that can be found at www.cityofomaha.org. Then click on the mayor's office, then click on the Disabilities Commission chair. And I was informed today that those videos are available there. I want to take a minute and remind you about kind of our mission and purpose, which means I have to turn the page. The Omaha Mayor's Commission for Citizens with Disabilities serves to promote the quality of life, accessibility, and equity in all aspects related to the City of Omaha on behalf of and in cooperation with the citizens of Omaha who experience disabilities. And to this end, we advise the mayor, the city council, city department heads, and other personnel on issues of access, representation, employment, housing, quality of life as they affect the citizens of Omaha with disabilities and their families. We also serve as a resource for Omaha citizens with disabilities and their families to express concerns and resolve issues that affect them. We serve to publicize to the citizens of Omaha the role of the Mayor's Commission and the resources available to assist citizens with disabilities, employers, housing representatives, business owners, engineers and architects, and others who have a role in bettering the lives of Omaha citizens with disabilities. We also work to promote awareness to the general public on the capabilities, needs, and desires of citizens with disabilities. We also work to publicly recognize the efforts of, for example, employers, businesses, schools, organizations, and others who've demonstrated outstanding support of persons with disabilities in Omaha. We serve as an advocate for accessibility issues and implement plans and projects to improve services. And we review and implement plans and projects for advocating for services for Omaha citizens with disabilities. I'll try not to say so much. I want to inform our audience that we'll have some announcements at the end of the meeting, so please have your pen and paper handy to take notes. At this point in time, I want to give the members of the commission that are present today an opportunity to introduce themselves in terms of who they are, what they do, and who they're here to represent. And can I start on my right with Natalie?
Hi, I'm Natalie Simmons. I'm founder and senior writer at Dotted Eye Writing Services, and we write grants for nonprofits. I'm a mental health advocate and also secretary of the Mayor's Commission.
Thanks, Natalie.
I'm Nancy Flurl, and I'm with the Nebraska Commission for the Blind and Visually Impaired. We provide vocational rehabilitation services to individuals that are visually impaired, blind, and deafblind.
Go ahead.
Hi, I'm Jen Pollock, and I facilitate special education services for Millard Public Schools, and I'm excited to be a part of the commission.
Yeah, I do want to add, not to put any pressure on, but this is Jen's first meeting, and we're very happy to have her here. My name is Mark Smith. I'm a faculty member of the University of Nebraska Medical Center. I work at the Monroe Meyer Institute for Genetics and Rehabilitation. I work for the University Center on Disabilities. I teach, write, etc. But more importantly, I am the parent of a young man with an intellectual and developmental disability, and also am the sibling of a sister with on the autism spectrum. So I'm here representing people with intellectual and developmental disabilities. We did find that we had a quorum, but a rather positive announcement. We will have several new members starting hopefully in the very near future. We've been short a few members over the last several months, but some new appointments were shared with us before the meeting. Given that we had a quorum available, we did review the minutes of several meetings. We've been short, and those were approved. So that kind of made up our pre-meeting. So at this point, I want to introduce Celeste Akers, who is the lead community services technician with the Nebraska Medicine Department of Psychiatry. Actually, Celeste and I are acquainted, being colleagues at the University of Nebraska Medical Center. Celeste will be here to talk about issues related to mental health and services that are being initiated through the UNMC Department of Psychiatry. So, Celeste.
Thank you, and thank you for having me here to the council. We always appreciate getting a chance to talk about things that have to do with advocating for mental health. And not only do I work in the Department of Psychiatry, but I also work now leading the new program called Behavioral Health Connection. So I'm actually going to spend the first few minutes talking about that program. And even though it's housed within our clinic of psychiatry, it's actually open to the community, and it's open to any member of the community who needs access information about services for behavioral health. That's the purpose of Behavioral Health Connection. It is a call-in line, but also people can call and make appointments, and they can meet with us if they need to talk about things like whether it's renewing their Medicaid or things like getting their Social Security benefits in line, different things that have to do with accessing their mental health and behavioral health care that they need. They can come and talk about that too. So our call-in line, here I have on the first sheet, is the 402-836-9292. And that's an Omaha number, Omaha area code. So that is available. It's a regular 8 to 5 office hours. It's not a crisis line. It's not a 24/7 availability crisis call center. What it is, it's an access center for information and for some help if people need help filling out forms, if people need information about how to file for their disability determination services, things like that. But more so, we're focused on what we say, behavioral health connection, which is finding referrals to different mental health services. If they were to need a psychiatrist, if someone is to need a therapist, if someone is to need developmental disability services, and different types of placement or different types of housing options for people in different situations, things like that. And I'll explain that a little bit more as we go through each of the slides that we have here. But Behavioral Health Connection, again, is open to the public. It's not just a Nebraska medicine service. And also, it is not a referral line for Nebraska medicine business and information. We give referrals for whoever needs whichever service they're seeking. So it is not a direct funnel of referrals to Nebraska medicine. That's not what this is. And it also doesn't expedite referrals to Nebraska medicine. It's a separate entity. It's actually grant funded and from a generous donor in the community, and it's just partnered with Nebraska Medicine because we already had the structure within our Department of Psychiatry to provide staffing for that. So I'm going to go on to the next form here. The program information, it's mostly meant to serve adults, and the reason we set it up that way, we will also talk to people that have questions about their teens or their children with behavioral health issues or mental health questions. But the reason we wanted it mostly focused on adults is because there are a good number of programs and supports out there to help children and teens, either through the school systems, through Project Harmony, if it's an abuse case. There are different systems through HHS, Department of Health and Human Services, if a child is in foster care and has a caseworker. But there is a relative lack of services for people that need support as adults, or help navigating the systems. And that's really what we're here for, is to help them navigate the systems of mental health care, or find out what's out there that they may need and how to apply. Again, it's also not a walk-in clinic. It's not there for someone to walk in and see a psychiatrist that day. Okay, it's not a walk-in clinic for therapy. You don't walk in and see a therapist within our department. It's a referral line for services that people may need. And that might include psychiatry, or a referral to who they could see. That might include therapy, a referral to whom they could see. But mostly it's available to adults, but also their family members. People can call, and actually it's also open to professionals. We get calls from social workers, or we get calls from people at other agencies that maybe they're used to dealing more with the child end of it, and they need some resources for that child's parent, or adult services. So it's also open to different professionals in the community to call us if they have questions on the different behavioral health resources that people might need. And again, also not to exclude substance use disorder, we also give out information about substance use disorder services, whether that's outpatient or whether people are asking about residential programs available. We mostly serve the Omaha metro area, and that's because we want it to be a tailored service for what people need. There's already the information lines out there for, say, the Nebraska Family Hotline, that's for children and families to call, the Nebraska Family Helpline. That's what it's called. There's also Region 6 and the different regions that people reside in that give out the information about different regions in the state and the different services that are available there. And so we wanted something that is more tailored to our community, something that helps people really navigate the systems of what's available within our area and what's available within the nearby areas. So people also call us sometimes from Lincoln, and sometimes from Council Bluffs, sometimes from Fremont, the surrounding areas of Omaha. But we want to be able to provide more hands-on and more tailored help to what's out there for people here, not just a call-in line from across the nation of generally what's available at Health and Human Services. So also it's a free program. That's another thing to highlight. It's not a fee for service. It is funded by a very generous donor from the community who saw a need for some extra help with navigating these systems and helping connect people to what they need and what they're eligible for. And so we don't want cost to be a barrier for people. We don't want it to be only available to people with insurance or Medicaid or Medicare. It's available to anybody. So that includes anybody who's uninsured, anybody who is insured. It's open to anyone free of charge. It is not a fee for service. No one gets billed for that. And like I said before, usually we get call-ins by phone. That's our main way of communicating with people, and often we'll mail things out. If people want written resources on things, we'll mail them out. Sometimes people just want the information over the phone, and we'll just dictate a few choices of different counselors in their area that take their insurance and so on and so forth. Or some people are calling for someone else, and they just want the information to be able to dictate to someone else. Like often those are the social workers or the service people that have a client with them or are going to see someone, and they want a listing of a few choices. So we do that by phone. The ones we do by appointment, it's usually if someone has called in and they have a rather complex issue, or they have an issue that someone needs to sit with them and help them apply on a computer for something, or if they need to figure out what they're eligible for like services and a kind of a broad spectrum of things, like if they're wondering if they might be eligible for Social Security or what that process looks like, or starting the process. And a lot of things are now online where people have to register online, and some people don't have access to a computer, or some people have difficulty using computers and technology. So we sit with them to help them. So that's what that means by appointment. And some of the people that we do help come from our nearby clinic. Well, we're housed within the clinic of psychiatry. So some of the patients that come to see us after they see their doctor or their practitioner, they also need help with some social service things or some help with some of the different referrals. And so they can come downstairs, we're on 4th floor there, and they can get the help with that while they're there. And so we try to do that so that they don't have to make a separate trip, because sometimes even transportation is difficult for people. So we do have some people that call and make an appointment and then come in. We're not part of Health and Human Services, and I should also just make that clear. We're not a branch of the government. We're not a branch of Department of Health and Human Services. We're just a separate entity that's privately funded and privately staffed. We are staffed up at University of Nebraska there at the Med Center in Pointer Hall with Psychiatry. But we are not part of HHS. So it's, I don't want people to get the idea that if they stop in to see us, it expedites their benefits or something, because I wouldn't want to misrepresent that. You know, it's just so that we can help people figure that out if that's something they need and they can't figure out. And again, our number is up there. It's 402-836-9292, and that's the general call-in line. And again, it's Monday through Friday available, 8 a.m. to 5 p.m., and it's not an after hours, and it's not a crisis line. And actually, we don't have a message machine to leave a message, and the reason for that is we don't want people to leave really important information that might be a crisis call or something that they really should be getting a hold of someone immediately for. We don't want someone to leave a message about that, say at 6:30 at night, and we not hear that the next day. You know, we don't want people to get the idea that we're there all the time and there's someone on call. Doctors' offices have people on call. This is more of a consult service, you know, a consultation referral service. We don't have on-call staff. So, are there questions about that, how that's operated, or? Okay. And I'll give time for questions.
A quick question, Celeste.
Yes.
So at this point in time, about how frequently are calls coming in?
You know, we get a few per day, and then we get a lot of referrals from, like I said, throughout the hospital. The different areas of social workers sometimes suggest that people call us. And so a lot of the calls we're getting right now are from different areas within the Nebraska medicine system. And that's perfectly fine. I mean, we're there to serve everybody. It's just that we aren't only there to serve Nebraska medicine patients, you know. And so, yeah, so we're open to calls from the community, or whomever calls.
So what's your strategy, or what have your activities been to date as far as getting this information out to the community at large?
Right. We've presented so far. We have, I think I have them printed off for you guys. We have some flyers about what we do. And they're called rack cards, actually. So we have those out at the different community health centers and also at our different UNMC different clinics to advertise what that does and who it's for. And then also we've presented this at, we've tried to go to the major mental health conferences around town, and so we were at the NAMI walk that they had recently for the National Alliance for Mental Illness, NAMI, Nebraska. Coming up here on September 8th, we're going to go and participate in, but also present this information at the Out of the Darkness walk for suicide prevention. And we're going to go to the Kim Foundation's event that they have on November 1st. We're going to go to the Women's Health Conference. So we've presented at the conference for women's health that Olson Center had at UNMC. So we're really trying to reach out to the agencies that we've given mailings to individual therapists that we have within our referral system too, so that they're aware that if they can't meet someone's need with something, or say that someone comes to them for therapy but needs also nurse practitioner or psychiatry services and needs a referral for that, they can call and ask who's available. And we're also not, like I said before, we are not a referral system just for Nebraska medicine doctors or just for Nebraska medicine practitioners. That's not at all what we do, actually. We help refer people to the services that fit their needs, like with their insurance, or whether they're uninsured, we can give them information for sliding fee places that they can afford better. We also give out referrals to, if someone wants a particular area, you know, of therapy that none of our therapists specialize in, then we'll look up, or we have a listing of different types of therapists. We also give out information about, we try to match people sort of with the area they're in, so they're more likely to go to their services, because that makes a big difference if it's convenient. So we've been trying to get the word out amongst, kind of coming back to where we've told people. We've been trying to do that with the different agencies. We went down and talked to some of the social agencies. The Center Mall down on 42nd and Center is now a lot of social agencies instead of businesses. And so we went down there and we talked to a lot of their social agencies down there. We've given the information out to like Community Alliance, the mental health agency, Community Alliance, places like that, places that serve people that would need that. So we're trying to get our word out. And this is just part of that, like presenting to the general public and letting people know we're there. And that's what we do.
And I heard about you through NAMI when I was calling to see if somebody from there would do a presentation. So they were very helpful, giving me your information right away.
Yes. Yep, NAMI is a place we went and talked to make a connection with people, and we've been to different agencies, trying to get the word out that we're here. So I'm going to go on to the next one. The reason we were formed, if you would say, put into play, and we were just formed in February of this year. So we're a relatively new program. We're, I guess we'd say 6 months in, right? February to August, close to 6 months in here. And the reason that the donor decided there needed to be a program and came and asked if Nebraska Medicine could partner to get this off the ground, he just noticed that there is not a lot of help for the adults in our community that have a mental health or substance use disorder need for services. It's hard to find information about coordinated services. And working in the mental health field for a few years now around Omaha at different places, I think, in my opinion, that sort of broke down when they no longer had dedicated health and human service workers assigned to everyone as their case. I think that happened back, I could be wrong, but I think around 2010 or 2011, I believe. So there is a subset of people that are adults that have assigned service workers still through HHS, and that would be people that have developmental disabilities, people that have traumatic brain injury, and I believe there might be one other subset that's specialized. I'm trying to remember what that is. People that have extreme medical need, like people that have had extreme medical needs since children carried into adulthood. So there are some areas where people do have assigned caseworkers and assigned service workers to help them navigate these systems. But other adults that still have a need to figure out these systems don't necessarily have an assigned caseworker to help them with that anymore. It's now the call-in line for Department of Health and Human Services, for Medicaid and for social services and for economic assistance. And for other things too, for figuring out who takes what type of insurance. If someone has been at their job, lost their job, and lost their insurance, who takes sliding fee if they don't have private insurance now? So it's things like that that we try to explain to people. We try to give referrals that can fit people's needs. And so when we say reducing the common barriers to care is what our overall goal is, kind of what I was speaking to is that sometimes it's just a matter of a lack of knowledge and available services and programs, because there is a lot of disparity as far as who qualifies for what program. There are a lot of different answers people can get as far as what programs are out there for teens versus adults. What is out there if a person, like I said, lost their job and now doesn't have insurance. Who can they go to that isn't going to be overly expensive, that they can afford care? So sometimes when people are in different situations, they just aren't knowledgeable about what's out there for them. And we don't want people to not have their care, or give up on trying to find their care when they really need that. So the other thing is the inability to coordinate care and register for services. Sometimes that's a large task for people, and sometimes that becomes an overwhelming task for people, especially if they're already dealing with day-to-day stressors or day-to-day crises, or sometimes it's just a matter of they have a child that has a lot of needs, or they have an adult child they're taking care of that has a lot of needs, and just getting those needs met day-to-day it takes a lot of energy. It takes a lot of work. And so sometimes just the coordination piece of things falls through the cracks because it takes work to make those connections, to different social services. The other third thing that I think I already mentioned is the inability to afford care or medications. Sometimes that is a real difficult one for people. And so we try to let people know about the affordable medication programs that they have. And I will say, granted, not every medication has an affordability program connected with it, but a lot of them do. And I think a lot of people don't know those exist. And I think that sometimes they don't ask their pharmacists, or they don't think that their medications could have a reduced cost, and some of them do. And so if there's a way to make things more affordable for people that already have limited finances, then that's a win for them. And then also lack of transportation. We have some availability to help with transportation, and it's mostly if people need help getting to like an initial appointment, if they need help getting to say, the access interview so that they can start up with their community services. There are some services out there that are home-based or community-based, but in order for a person to start in with them, they have to go to the agency and have an intake interview, or they have to go to the therapy place and have, let's say, a chemical dependency eval, in order to get into services. And sometimes just getting to that initial appointment is something that people can't figure out how to do. If they don't have a car, or if they don't have friends that are reliable, or they don't have gas money, or what have you. So with the lack of transportation, we try to help out on that end so that people can facilitate services. So that's not a barrier in itself to people starting their services. We also help people figure out transportation options, especially now that the 3 Medicaid MCOs, managed care organizations, have all contracted separately with separate transportation providers. Some people are a little bit confused as to how to go about that process of requesting a ride, requesting a specialized type of transport ride, things like that. And so we can help get them in touch with the right people at those managed care entities to help them arrange their transport. That would be for medical only, though, through the Medicaid and MCOs. It'd be for medical care. Also therapy care and day programming and things like that. And also with the transportation, some people qualify for the MOBI assisted ride, and some people have a difficult time getting their records in line or getting the applications done for that. It's a long application. It's about 20 pages of medical reason as to why people need assistive help with transportation. So we help with helping people figure out their MOBI applications and things. So as far as transportation goes, we don't want it to be another barrier to going to where they need to go for care. So, I'm going to change the slide here and talk about our services. So the things that we try to provide for people is trying to find the services and programs that fit the client's needs. And this is what I was going back to, that we actually are not a scheduling and referral line for Nebraska Medicine. That is not what we do. We actually take the calls from our scheduling department when someone decides they aren't going to have services with us, and try to find other services for them. So we are not a referral funnel for Nebraska Medicine Psychiatry. Rather, we try to find services that fit their needs with location, with availability, with insurance need or lack of insurance. And so the services we try to find for people would include things like psychiatry, substance use disorder treatment programs, therapy, mental health therapy, community support programs, and that includes things like day programs or elderly care programs for day programs, and medical care. If a person needs to know where there's sliding fee clinic for some medical care, things like that that they aren't aware of, we have a listing of those too. So the other thing that I kind of touched on is we help to explain and register people for their benefits, if that's something they need, because not having benefits is such a barrier to getting care. If they're eligible for Medicaid but they don't have a computer or know how to apply, then they're limited with only seeking out the services for uninsured people with low income, whereas if they get onto Medicaid, they have a wider variety of people that can serve them, because a lot of providers accept Medicaid. So it's things like that, or trying to explain to people when they've been on disability for 2 years, they'll become eligible for Medicare, and how to choose like a Medicare supplemental program so their medicines are covered, along with just their services. So things like that, trying to help navigate the system of benefits. Facilitating care coordination, and like I said before, that's if a person needs to know how to register for services. Say they have a psychiatrist and that person says, we would recommend that you go to a day program. If they end the visit there, they don't know what their steps are to seeking out or registering for a day program. And so we help people along those lines of how do they facilitate the services they've been referred to. And again, I said assisting with transportation and assisting with medication affordability. And that's trying to find the programs that are out there that they might be eligible for that could help with medication assistance or with transportation assistance. We don't have a separate reserve fund like to pay for people's medications. So I don't want to misrepresent that either. When I say medication affordability, it's programs to help them find affordable medications. We don't have vouchers for medications. Some of the federally funded health clinics have their own pharmacies that can offer some of that, but Nebraska Medicine can't offer that, so I don't want to misrepresent that. And I kind of like to go over I think my microphone's ringing, I'm sorry. I like to go over the exclusions, what we are not, because I don't want people to get the wrong idea either. So, so we're not a crisis line, like I've said before. We have numbers to crisis support and crisis referral, but if someone is in crisis, they should be using the same steps that they take, which would be calling 911 or going to their local emergency closest room if it's a mental health psychiatric emergency. So we're not a crisis center for emergencies. We're not a walk-in clinic, like I've said before, to come in and get services immediately. We can refer people to different clinics, but we don't have staff to just see people immediately. And we're also not an extension of DHHS. So we are not part of the state Health and Human Services system. We can certainly explain the processes of referring to those and such, but we are not like an expedited branch of HHS. So I just like to put that out there because I don't want there to be confusion with what we offer. So I'm going to take a few questions on that, and then my second part of describing things is actually another PowerPoint presentation too, but it's just a rundown of what we offer at Nebraska Medicine Psychiatry for the outpatient services that we have. But first I'm going to go ahead and ask if there are questions I didn't cover about what we try to do with Behavioral Health Connection.
I'm just curious if you keep track of the number of referrals that actually make and keep an appointment or stay on for that regular need.
Yep, we try to do that. That's the difficult part is we have a separate database, and it doesn't have identifying information as a patient database would because it's client call in. But we do take down people's names and callback numbers if people want to give us their identifying information. If they don't want to, it's okay. People can still call us in anonymously or just call in and use their first name if they don't want to identify themselves. But we do callbacks after a couple of weeks of people calling in to us, and we try to get a hold of them and ask them, if they were able to connect to services or if they might need other referrals, if they had other questions. It's kind of difficult because sometimes once people have called a referral line and they have what they need, they don't call back. You know what I mean? So we try to make callbacks. People don't always call us back, but we're trying to track that. We would like to know that for outcomes.
Thank you.
As a VR agency, we too work with a lot of resources in that, and so employment is so important for individuals with all kinds of disabilities. Could you talk a little bit more about the employment support?
Sure. And that's part of when I said that we don't do the out in the community part. Right, that is Voc Rehab, and that's what Voc Rehab does. And that is also what, like the WorkSource program at Community Alliance or the Goodwill Job Resources programs that they have for different levels of abilities. And also, sometimes people need to know about their status with, if they're on Social Security already for disability, they need to know what they can earn in order to keep a balance of income and benefits. And so we try to refer them to places that can explain the Ticket to Work program to them and things like that, like Community Options is a place that describes that to them. And also if they're involved in WorkSource. And Easter Seals also does that. And so, so when we say understanding supportive employment, we give them the information about the different agencies and how to apply, or what type of a referral they would need, or what type of release of information and referral they would need to get set up with say like vocational rehab or things like that, or different agencies that are actually tailored to different needs for people, because there are different types of programs, based on what people need.
And I think that's what's so important for them to hear about all the different options you just discussed. Thank you.
Right, sure. Any other questions for me on the program? And I'm also going to leave this information with each of you so you can keep it, review it. And did you want me to go on to the Nebraska Medicine Psychiatry and what we offer through psychiatry?
That'd be great.
Okay. All right, let me get to my other PowerPoint here. Okay. So as I said also, I also work within the Department of Psychiatry with their outpatient clinic for Nebraska Medicine and UNMC. And part of what we offer through that is lifespan services. And so we have services for adult, geriatric, and child adolescent care. And so they have services that run the gamut of ages. This is just within the psychiatry clinic. We do have a psychology clinic as well. That's for adult psychology and adolescent psychology. And then we have Monroe Meyer, which Mark Smith spoke to, and that's mostly centered for children and teens with developmental disabilities or also autism spectrum and things. But they also have an adult provider there too, and they're trying to expand their adult services. So we have a variety of different clinics and services throughout UNMC and Nebraska Med. This one is particularly about the psychiatry clinic, the outpatient clinic, because that's where I work and that's what I know the most of. So, so I'm going to go ahead and advance the slides. And I will also say that we're located in a clinic building on the corner that's actually by Clarkson. It's on the corner of 42nd and Dewey. It's called Pointer Hall. And so if people come in for appointments or evaluations, it is not in the main Durham outpatient center. We are in our own little clinic on the corner there across from the Clarkson parking lot. I just like to make that clear so people aren't confused if they do come in for services. So, and at the bottom there we have our website where you can read about our different clinic services and the different faculty that work there. And this is an overview of things. So right now we've changed over, and this is one thing I did want to highlight. They changed over to a clinical care model that is a consult model, and they changed over to that just starting in July. And so what that means is that for the adult and child adolescent clinics, they're now using a consult model where a person has to have a referral from their primary care doctor in order to get in for services. And the reason for that is they're going to have some people stay in clinic with continuity, and then some people will get referred back to their primary care providers with a treatment plan. And that's actually been an initiative to improve access for new clients, because if we take on new clients and take on new clients and take on new clients, but we don't discharge people back to a primary care doctor that can manage the cases that can be managed that way, then we end up having a roadblock of any new patients. And so we're trying to create access by doing that. And that also doesn't mean that people will not have a provider necessarily in psychiatry. The thing is, people will come in for an evaluation. They'll see a psychiatrist or psychiatric nurse practitioner and have an evaluation. They'll have a few sessions till they're stabilized with their mental health and psychiatric issues. And then most of those patients will get a tailored plan and sent back to their medical doctor, their PCP, their primary care doctor, with the plan and with the contacts for the psychiatrist that saw them to follow up if that doctor needs follow-up. And then also people can come back in, let's say they have a relapse of something and their doctor doesn't feel like they're the best person to handle that, they can be re-referred and come back to see psychiatry. But it's just a way to keep things open with new patients too, so people can get in for services when they need that, when they need specialized services. And then some people, like I have on here, for patients who do have a need for consistent specialized psychiatric care, they are going to continue seeing a psychiatric provider in our clinic. So people come in, they have an evaluation, they have a few sessions of treatment with a psychiatrist or psychiatric provider, and then that provider decides, is this a person that probably needs ongoing psychiatric specialized care to stay in our continuity clinics, or is this a person that is pretty stable, their medications, they have a good handle on those, and their medical doctors could prescribe that too. And if that's the case, then they'll probably be referred back to their primary care. And if anyone wants to do a referral, the doctors or the patients can call in to the main call-in line. And that's the one that I've put on there, which is the 402-552-6007. That's the main client number to the clinic. And doctors within the Nebraska medicine system can do an electronic referral, just like they would to any other referral agency. So this is just a listing, and I'm not going to go through all of them, and they are probably a little bit small on your screen there. But those are all our different psychiatrists and psychiatric nurse practitioners. Oh, do they have a way to make that bigger for me? Yeah. Thank you. There we go. Thanks. Okay. So these are the different psychiatrists and APRNs, nurse practitioners, and PAs, psychiatry assistants, the physician assistants that we have within the adult psychiatry clinic providers and their different specialties. So we have people that specialize in a number of different things, and then they also see people for general psychiatry appointments too. And I just put on their specialties so that people can know that we have people that specialize in things like treatment-resistant depression, anxiety disorders, developmental disorders, chronic medical issues, women's issues, particularly for like postpartum depression and things related to pregnancy and postpartum. And then we also have some people that specialize in what they qualify as serious persistent mental illness or severe persistent mental illness. And they call it SPMI is what everyone shortens that to. But we do have people that specialize with that too. And any number of those different diagnoses, if someone needed continuity of care and follow-up from their doctors, they would keep them in clinic for continuity. It's just that if someone has a disorder or a symptom set that can be handled relatively easily to be stabilized and then on medications and stabilized, then they would refer them back to their primary care. We also have some geriatric care providers, and they're actually in their own department of geriatric psychiatry, and that is Dr. Baumgartner is a new doctor that started with us this July. And then we also have two that have been there with us that are probably familiar to people. One is Dr. Thomas Magnuson, and the other one is Dr. Steve Wengel. And Dr. Wengel is actually the geriatric division director right now. So those are our providers for geriatric psychiatry. We have child adolescent psychiatrists too, and that would be the ones you see here. Dr. Edwards is now our division director. And the other ones specialize in different things, but again, also provide general care and general psychiatry. And Dr. G, he sees people particularly with eating disorder concerns, but also, again, general. And Dr. Wong sees people for disruptive behavioral disorders, and he also does research for different areas of psychiatry. Dr. Liu, he's our psychiatry department chair, actually, for the entire department. And he specializes in pediatric mood disorder, but also sees pediatric and adolescent patients. And Dr. West, who sees a lot of patients that have autism spectrum, but also adjustment disorders and mood disorders and such too. We have some therapists on board with our child division, as well as our adult division, and I've listed them here. And actually, Katie Quartz, or Katrina Quartz, is starting in September, so she's on there. She made the list, but she's actually not in our building, feet on the ground yet. But we do have two others, Dr. DeLisa, who's a psychologist, and then Laura Schutte-Lundy, who's a therapist, master's level. And then our other therapists there are with our adult division. That would be Denise Falcon, Beth Farrell, Jody Gentleman, Megan Kankowski, Debbie Pittick, Russell Rosenquist, and Brian Shaw. And I'm going to give you a minute. I didn't mean to go through those so quickly for the person helping us with signing. So we do offer individual therapy sessions, but they also offer group sessions if people are interested in adult behavioral group sessions for therapy, and those are run by the therapists. I don't know if I've included a slide of that. I think I might have skipped that one, and I apologize if I skipped that one. Oh no, I went through the subspecialties, and I'll have the ones at the end. Okay, so now that we have a referral system and they have providers that specialize in things, they're starting to do subspecialty clinics to try to provide specialized care. They still provide general care as well, but they also have specialized care. And so I've listed some of those off here. One of them is the reproductive clinic, or we also call it the women's clinic. And that is the one that mainly helps women who are around the pregnancy or postpartum phase, but they also help in different areas of life, like perimenopausal and such like that. And they have a few different practitioners that specialize with that, and they also have a therapist that particularly sees people through that clinic. The other clinic that we have that's subspecialty is for psychosis, or what they also call serious mental illness and thought disorder. And those would be for diagnoses such as schizophrenia or schizoaffective disorder, delusional disorders, or severe mood disorders with psychosis as part of their diagnosis. And so they try to manage their symptoms so that they can have optimal functioning. And most clients involved with this would probably be in a continuity clinic, because it usually takes some specialized care on a continuum, and also to manage, to try to prevent relapse prevention and things like that, for relapse prevention. And we have a few providers there, and we also have a therapist that works with that clinic. And the other two subspecialty clinics that we have, one is for treatment-resistant depression, and that is actually one that is meant to be tailored for medication management if people have tried other things or other approaches that haven't worked well for managing their depression. And so they also do other evidence-based interventions. Sometimes they recommend ECT. Sometimes they do genetic testing for medication effectiveness to see what the medications would be most effective for that person's particular genetic makeup. And also they are starting to try to do ketamine treatment. They have to get that set up. That's one thing that's in the works. And then some referrals to TMS, transcranial magnetic stimulation. We don't offer that at the med center, so sometimes they refer that for other people. So we have a few providers that help particularly in that subspecialty clinic. And then we also have a subspecialty clinic for anxiety disorders, and that would be for people whose main presenting issue is an anxiety disorder, such as either generalized anxiety or panic disorder or post-traumatic stress disorder, PTSD. And they try to incorporate cognitive behavioral therapy, so CBT techniques, to learn different coping skills along with medication management. And they really want people to have a safe and effective medication regimen. They try to make sure that they're on medications that aren't going to have a rebound effect or have people later addicted to medications and things like that. They try for a safe, productive medication strategy for that. So we have a main doctor, Dr. Edwards, and then we have 2 psychologists that work with that team, and also a therapist, because they want to refer people to the groups that, and also the therapy that helps manage thoughts that go along with anxiety disorders. So we have that as well. And I think this is where I have the therapy group slide. So we have the therapy groups that are offered and are therapist facilitated. And people don't have to be involved in a group, involved in individual therapy through us, or have an individual psychiatrist. They can do a therapy group if they're referred by an outside therapist too, that's fine. So one of those is dialectic behavioral therapy. And dialectical behavior therapy is a proven method to help people change their thoughts, their feelings, their behaviors and emotions. It deals a lot with interpersonal interactions and a lot with coping with stress and crisis, to be adaptive in that way. And then they have cognitive behavioral therapy for anxiety, as I mentioned. So for the people that get referred either from the anxiety subspecialty clinic or even from their outside providers or a generalized provider in the clinic that decides that they would really benefit from some coping skills for anxiety, they can go to one of those facilitated by a psychologist. And that's a 4-session group. And so then they have specific skills they work on in sets at each of those sessions. And afterwards, they can still be referred to their individual therapy. It's just that it's a supplemental therapy group for people that are doing individual. And then also they have a psychodynamic group for people that just want to process through maybe their maladaptive thoughts or behaviors or conflicting emotions. It's more of what you would say relational therapy and relationship skills. And that is actually ongoing for 24 weeks. That's a long group. For people that want to have more of a sustained group therapy approach, maybe I would say like traditionally what people think of as group therapy. So that's available too with Brian Shaw. And people would register by calling the main number again, the 552-6007 with the 402 prefix. It's an Omaha number for Pointer Hall. We also offer addiction treatment services, and that is for any substance use disorder. We have an outpatient level 1 level of care, which is they would see their psychiatrist maybe once or twice a month, and then they would see their therapist probably once a week. So that's what's called outpatient level 1. And then they also have IOP, intensive outpatient programming, and that is where people have more frequent sessions with their psychiatrist. They also have more frequent individual therapy sessions, and they also have weekly, a few times a week group sessions. So that's a more intensive program for substance use disorder. And both of them, the outpatient level 1 and the outpatient IOP, they offer medication-assisted treatments from a psychiatrist. And one of those is Suboxone for the opioid addiction treatment. And the thing that's kind of special about that is not all doctors are licensed to do that. It takes a specialized license to provide Suboxone treatment. So our 3 providers that work within that group are all licensed for that, if people need that. And they also have medication-assisted treatment for alcohol use disorder and opioid use disorder. But they also treat just a variety of different substance use disorders. It's meant to run the gamut for different treatment. That is actually located in a separate building. They have room now. We expanded, and so that is offered in the Clarkson Building, Doctors Building South on 7th floor. So we now have more space, and now that clinic is over in 7th floor, Doctors Building South. Yes. And if people wanted to register for any of those services, they can either dial our main clinic number, which again is the 402-552-6007, or they can dial the main clinic number specifically for substance use disorder clinics, and that is the number 402-552-2071. And then the therapists that work there will do an assessment within a day or two and get people started on the right level of services that they need. One thing we don't have a residential treatment program for substance use disorder at Nebraska Medicine. And we don't do methadone treatment. That requires special licensing. There are only a few places in the state that do methadone clinics. So we don't do that. And I just like to put that out there because sometimes people have questions. And I don't want to misrepresent that either. So. The other thing, these are just the providers we have for the addiction services and the different levels of treatment they do. So we have dedicated therapists that work with those programs and the IOP program as well. And then if people are in recovery and decide that they've graduated from the treatment programs for substance use disorder, they can certainly be referred. If they still need the dual diagnosis part of the mental health services, they can be referred, of course, to psychiatry or to psychology or to an outside provider. But the substance use services are meant for dual diagnosis with mental health disorder along with substance use disorder. And there we have our services. That is a conclusion of that. We're going to close that out. I know that was a really quick and brief overview of things. I hope it's been helpful, though. And I wonder, are there any questions on the services that they offer there through psychiatry or what they do or do not offer for people?
I thought it was really detailed. Thank you so much.
Oh, thank you. I tried.
And,
No, really helpful, Celeste. Thank you.
All right.
and just the handouts and everything that you covered, and for it to be, so anyone that's viewing in the audience, will be able to take it down. And especially you repeated the telephone number repeatedly. So that's so important for people to access services. So thank you.
You're welcome. We just want services to be available to the people that need them. That's what we're about. So.
Thank you, Celeste.
Thank you.
We just have a few minutes. I don't believe we have any old business in terms of subcommittee reports or new business. I think I did mention that we have some new appointments to the council, so we'll have some new faces coming. We do want to welcome Jennifer today. I think we have a few minutes if folks have any activities they want to announce for the areas that they cover.
I don't have any announcements.
Okay.
Well,
Nancy.
I will announce between now and our next meeting, Radio Talking Book, which is a radio reading services for individuals who are blind, visually impaired, or print handicapped, will be celebrating their 45th anniversary on September 18th. So they're located at 7101 Newport Avenue, and I think it's just a drop-in open house from like 9 to 4 or 9 to 5 that day. So they have provided quality services for many years for individuals. So,
Thank you.
I just think that for Millard, we are really excited to be a part of the groundbreaking today at the new MMI site. So thank you for that opportunity. It was great to be there.
Yeah, that just stole my thunder, Jennifer.
Oh, sorry.
No, I'm teasing. I did want to mention today was the ribbon cutting for the new Monroe Meyer Institute that will be tentatively opening in late 2020. It's going to be in one of the former First Data buildings at just east of 72nd Street on Pine. And I was there as well. It was a terrific ceremony. The mayor was there, Lieutenant Governor, and many other officiaries. So Pretty big day for us, and we're looking forward. We've been in the same building at the Monroe Meyer Institute since 1958. So needless to say, we've well outgrown our space. I do want to thank our sign language interpreter for doing an awesome job as always. I do want to remind you that this broadcast will be this broadcast will be taped and rebroadcast on Cox Channel 18 on Tuesday evenings at 7 p.m. I want to thank Gerald Kuhn, although I think Gerald left, for his hard work, and Kat, of course, for their hard work in getting that going and keeping it going. Our next meeting is scheduled for September 23rd at the Legislative Chambers at the City County Building. And with that, I will adjourn the meeting. Thank you for your attendance. And again, thank you to Celeste Akers for her presentation today very much.
Thank you.